We had a really exciting event. We had about 130 people coming from all backgrounds, from clinical backgrounds, service user backgrounds, partner agencies, and some of our philanthropic backers as well. And with ENSU and the Department of Health, we brought together our Minister, our CEO, some excellent presenters and some really good exhibits. So it was a really powerful day describing what has been achieved in the first 5 years and where we go next for the next 5.
From the National Service User Executive, which is a statutory body that represents the views of service users and carers in the mental health field in Ireland. And they did a survey of service users around the country and received a very, very big response this year. And one of their awards is for the most improved service over the last 3 years. And we were delighted to be the recipients of that award this year. It's the first time that they've given that award. So we are very, very delighted to have that. And the fact that it actually comes from our service users, it means that the feedback about the service in West Cork is very positive.
I first engaged in West Cork Mental Health Services as a user in 03 and found it very dissatisfying. It was a prescription of pills, a 15-minute interview once every 2 weeks, and nothing really was resolved. So after a year of that, I went away and I decided, look, it's not working, I'll go back to work. So unfortunately in 06 I had a similar experience which brought me back to going back to the service, and I was actually, I was encouraged by the doctor at the time, and I said no, I didn't particularly feel it was very useful last time. But when I did go up and I met Professor Bracken here for the first time, I was absolutely blown away. The change was phenomenal. Believe me, it was. It was. This man was advocating, a reduction in my medication, a more sort of biomedical kind of thing, approach to it. Whereas treating me as a whole, making me feel that, like, look, you're important, we need to talk more, We actually talked we had sessions that lasted an hour, and I'd never had that before, so 15 minutes to an hour. So, my recovery was fairly quick, and it brought me to realising that, I felt that perhaps maybe I could give something back. So I joined in, if you like. I was invited in as part of the team.
We have set up an assertive outreach home care team, and this involves nurses and the team going out to nurse patients who are acutely ill in the acute phase to prevent them going into hospital and following up with the teams. Now, this has greatly improved the patient's care, and also it is minding the patients in their own home, which I think is very good, and this is what I think a lot of Vision for Change and recovery of patients out in the community means.
In Lochray Athenry, we have a really well-resourced team. First of all, we're one of the few multidisciplinary teams in the country that has all the disciplines that Vision for Change would recommend. We have very much a recovery-focused service. We have participation from service users, from family members. We, particularly over the last 2 years, our emphasis would be on building a service around the individual.
Well, we welcome Vision for Change. I mean, since 2006, it has been our roadmap towards the development of our services. Certainly, it will guide us to the next 5 years forward. We would hope that we would, in line and in consultation with stakeholders and particularly users, that we develop the most appropriate services for users, that is community services.
Being here today, it's a fabulous fillip for the service itself, but I think it's a great reward for us. It shows us perhaps that we're doing some things right. There's some things that we can do better and we can always improve. But I think to get feedback from the people who use the service is vitally important. And if we're getting that right, well then we're going part of the way to improving. It's a long road, but we're on that road, and it's a good place to be today.
But I do think today's event has shown us that we have reached, at the midpoint now, we have reached a point where there's a lot of hope and a lot of enthusiasm about the changes that are happening in our mental health services. And in the past few years, we have seen a lot of change. Change is a very difficult thing to bring about, and it happens slowly and often happens below the radar, particularly the kind of cultural changes that we've talked about so much in Vision for Change. The principles of recovery, for example, what the service users are telling us they want, more information, more engagement from clinicians, more engagement from the services, and that is starting to happen now, and I think it's a very positive thing. And I think partnership is another word that I would come away from today, with partnership between the department where I work, the HSE National Office, the HSE service providers, the service users, the NGOs and philanthropic organisations. None of us can do this on our own, but by all of us working together, we can certainly put together a very formidable partnership and achieve the kind of changes we want. So hope and ambition and partnership and working towards recovery is the way to go.
And particularly the way Vision is constructed, you need to bring service users and clinicians and people who have a long tradition of doing things in a certain way, and they're invited to change that view entirely. So that takes a lot of work and a lot of communication. What I'm really pleased about it, we're pointed very clearly towards Vision for Change. Certainly there are challenges, there's no doubts in terms of the additional resource we require, and holding on to some talented staff we have has been a challenge. But at the same time, it actually liberates us to some extent in terms of probably letting go of some of the practice of the past and adopting more modern service practice.